You get an eye infection, you think, simple, I just need some antibiotic eye drops, right? But what if I told you that in eye care, the decision to use or not use an antibiotic is actually one of the trickiest balancing acts in all of medicine? Let's try and bring this whole thing into focus. And yeah, it turns out our collective view on this is, well, it's pretty blurry. We see antibiotics as this easy, quick fix, but we might be totally missing the bigger picture. And in that bigger picture, the cure itself, that's what could be creating a much bigger problem down the road. And that really gets to the heart of what we're talking about today. What happens when our go-to solution for today's problem becomes the very thing that makes tomorrow's problems untreatable? It's this crazy paradox that doctors are wrestling with every single day. So to get our heads around this, here's our game plan. First, we'll look at the risk hiding in plain sight. Then, we'll dive into that delicate balancing act. We'll explore the bad habits of overuse, but also the devastating cost of hesitation. And finally, we'll cover the smart playbook for getting it right and what this all means for the future. Okay, let's kick things off with something that's probably going to surprise you. When I say antibiotic resistance, what pops into your head? Hospitals, maybe? Nasty superbugs? I bet the last place you're thinking of is your local eye doctor's office. But you really, really should be. I mean, check this out. It's kind of wild, but ophthalmologists are some of the biggest prescribers of antibiotics out there, like in all of medicine. So what's the deal? Well, a lot of it comes down to this feeling that, it's just an eye drop, what's the harm? But that tiny little drop, it's a huge piece of a much bigger, scarier global problem. And that's exactly where this idea of antibiotic stewardship comes into play. Now, let's get one thing straight. This is not about just using fewer antibiotics. It's about being smarter. Think of it like a sniper, not a shotgun. It's about using the right drug for the right bug at the right time. So these miracle drugs are still around when we really, truly need them. And man, that precision is everything. Because every single one of these decisions is like walking a tightrope. It's not as simple as treat or not to treat. It's a constant, high-stakes balancing act between two totally different but equally terrifying dangers. And here it is, laid out plain and simple. On one side, you've got overuse. Every unnecessary drop basically helps train bacteria to fight back, creating superbugs that our best medicines can't touch. But lean too far the other way into underuse, and the danger is immediate and devastating. We're talking about someone losing their sight. Forever. Both are failures, right? And doctors are stuck right in the middle, trying to walk that razor-thin line. All right, so let's tackle that first side of the scale, the one we hear about all the time, overuse. This whole idea that more is better, well, spoiler alert, it's not. So what does this overuse actually look like in the real world? Well, it's things like keeping a patient on antibiotic drops for weeks after a simple surgery, even though the evidence says they don't do much good after about 3 days. Or, just defaulting to that combo steroid antibiotic drop for almost any patient who walks in with a red eye. These are practices driven more by habit than by science. And that really gets to the root of it, doesn't it? A lot of this overuse isn't about what the patient clinically needs. It's about human nature. It's that just-in-case prescription, a defensive habit that feels safer in the moment, but is actually making all of us less safe in the long run. Okay, to really get why one of these habits is just, well, totally illogical, we need a super quick science lesson. Antibiotics have one mission: kill bacteria, eradicate them. It's an all-out assault. You don't gently back off. You go in, wipe them out, and then you're done. Now, steroids, they're completely different. Their job isn't to kill anything, it's to calm things down. They suppress inflammation. And because of that, you have to wean the body off them slowly. If you just stop cold turkey, that inflammation can come roaring back. So, you put those two things together and you can see why those combo drops are such a problem. When you taper a combo drop, you're doing the right thing for the steroid, but you're doing the absolute worst thing with the antibiotic. You're giving this tiny, weak dose that isn't strong enough to kill the bacteria. You're basically just showing the enemy your playbook. It is the perfect recipe for breeding resistance. But look, that's just one side of the coin. Overuse is a huge problem, for sure. But now we have to talk about the other side. The side that doesn't get as much press, but can be so much more devastating so much faster. And that's the cost of hesitation. There is a golden rule when it comes to serious eye infections, and it's this: the disease will always move faster than the drug's toxicity. Always. So when you're facing a really, really bad infection, this is absolutely not the time to be timid. And if you want to see what that means in the real world, look at this. On the left, an infection that was caught in time. It's treatable. On the right, that's what happens when you wait. That's the catastrophic result of delay. In these situations, a wait-and-see approach isn't being careful. It's playing Russian roulette with someone's vision. So here's the crucial takeaway. Good stewardship isn't always about holding back. Sometimes being a good steward means hitting an infection with everything you've got, faster and more aggressively than you might normally think, because the alternative for that patient is permanent darkness. Okay, so with all this pressure, this insane balancing act, how does a clinician actually make the right call? Well, it's not about guesswork. It's about having a really clear, structured playbook. And that playbook really boils down to 3 logical steps. First, size up the threat. Is this a minor issue or is it a sight-threatening emergency? Second, act decisively. Go gentle for low risk, but go hard and fast for high risk. And third, and this is so important, set a review point. Decide right then, I'm checking back in 48 hours, and if things aren't better, we escalate. And for those high-risk cases, acting decisively also means acting smart. That means getting a culture to find out exactly what bacteria you're fighting. It's not a delay, it's gathering intelligence. It's what lets a doctor move from an educated guess to a targeted attack on the specific invader. And you know what? This isn't a solo mission. Smart stewardship is a team sport. It means working with the microbiology lab, using their local data. This report, called an antibiogram, is basically a cheat sheet for the local battlefield. It tells doctors which bugs are common in their area and which antibiotics still work against them. And that local intel always beats a textbook guess. So let's just zoom out for a second. This isn't just some technical medical issue. These small decisions happening in eye clinics every day have a ripple effect that touches all of us, and it's shaping the future of medicine. And maybe the best way to think about it is this. True stewardship is about making choices today that you can look back on 5 years from now and proudly defend. It's about having respect for the power of these drugs, for the patient in front of you, and most importantly, for all the future patients who are going to need these antibiotics to work.